Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill.
And I'm Sally Pace. And today we are joined by Tim Hawley with Exemplar Health. And Tim, thank you for being on the show. And we've gotten to know each other through industry events and spending time together. And I've heard you talk about this before. So the topic today is the healthcare system and what makes it broken. I know you've said before that you believe that it's not by accident, but it's by design. What do you mean when you say the healthcare system is broken?
Yeah, sure, Sally. What I mean by that is there's ultimately just misaligned incentives. So myself personally, I've been in the industry for 27 years. The financial sector is the only career that I've ever been in. And when I first started out in the business, I was very, very fortunate to be mentored by two what I would call movers and shakers in the insurance industry. These were folks that built insurance companies, sold insurance companies, built insurance products, and some of those insurance products are still thriving to this day. So early in my career, I was blessed to be around some very, very prominent insurance companies' boardrooms and heard the conversations that went on. And, when I go out and give my speeches all across the country about why I think the healthcare system is broken, the conversations that you'd actually hear behind the curtain would absolutely make you, they're disgusting, to be quite frank with you. And I won't mention any companies' names because that's not relevant. The issue is what's relevant. So when I go out and give my speeches, I always ask people, how many times do you think I ever heard in a boardroom them say, hey, let's do what's best for the American employer? It's crickets, right? What's best for the American employee? Once again, it's crickets. And then I ask the question, what do you ultimately think the conversation always relies around? And it's about maximizing profits. And, we'll talk about it, I'm sure, a little bit later. I'm all about making a profit. I'm against being a profiteer. Okay. And a lot of these companies, they're not just about making profits, they're profiteers. So with that being said, there's misaligned incentives. They want to maximize profits, which means the way to do that is the healthcare costs keep going up and up and up and up and up and up and up, because at the end of the day, they're answering to stockholders or private equity firms. And that is the CEOs and the executives' job is to maximize those profits. And at the end of the day, it's bad for the American employer and it's bad for the American employee.
It's so interesting that this whole healthcare system is built on profits. And, obviously everybody that's in business wants to turn a profit. So what are you doing today to stay in business, but also fix what is broken?
Yeah, it's a wonderful question. But before I answer that question, I'd like to ask, Sally, I'm going to ask you a question. So you have to play along, because this analogy really sums up why the system's broken and how we're trying to fix it. So Sally, dare to dream for a second.
Okay.
If you were to go purchase a brand new car or SUV and you're daring to dream, what is your dream vehicle? What would you go purchase?
I would build a Rivian.
Okay. So you're going to build a Rivian. So you go into this Rivian dealership, right? You build your dream Rivian. Would you ever take that vehicle off the lot and forget to ask how much it cost?
Not at that price point, but no.
No, of course you wouldn't. Now, let me ask you another question. So in the morning, you wake up at 4:00 in the morning and the right side of your stomach hurts really, really bad. To the point where the next day you go in and you see your primary care doctor. He sends you off to a specialist. The specialist calls you up the next day and says, Sally, I have good news and bad news. What do you want first? And you said, well, give me the good news. The good news is, Sally, I know exactly what's wrong with you. The bad news is your gallbladder is only working at 50%, and you have to have your gallbladder out within the next couple of weeks, more than likely. That'd be my recommendation. So, Sally, here's the $1 million question. You go down to your local hospital, and after the anesthesiologist gets done with you and you've done the MRIs and you had the surgeries and all the medicines in the hospital, within $1,000, give or take, how much does it cost to get all of that done and your gallbladder out? Within $1,000 either direction.
As the American consumer, we don't really have any way of knowing, or we feel like we don't.
When do you find out? When do you find out, Sally?
After I've been cut open and sealed back up.
When you get a bill.
Get the bill. Yep.
Yeah. And hope there's not any complications.
Okay. So I don't know if I can say this on this podcast. You might have to bleep this out.
Go for it.
But how asinine is that? And that's what's wrong with the American healthcare system. Okay. It is the only American commodity that we drive off the lot blindly and never ask how much it cost. That is by design. Sign me up for that business. I'm in the insurance business. You know what? Hey, here's a life insurance policy. By the way, I'm going to tell you how much it cost in 2 months. It's by design. The American consumers have been brainwashed by large insurance conglomerates, hospitals, and large PPO networks and big pharma to think that driving healthcare off the lot is normal.
It's crazy.
It is not normal and does not have to be normal, but you have to know what you're doing behind the scenes and work with a company like Exemplar Health and some of our consultants so we can crack the code, because you can absolutely drive healthcare off the lot wisely, save a ton of money on insurance premiums, get better outcomes and better results. So the way that we're tackling the problem and fixing American healthcare is, number one, I just proved to you how it's broken. Okay. Now, how in the world do you fix it? You have to work with people that are behind the scenes and movers and shakers and understand how not to drive healthcare off the lot blindly, but wisely. So you're saving money up front and you're also getting better outcomes. Okay. So let me elaborate on this for a second. Insurance companies, depending on the insurance product that you have, the Affordable Health Care Act, first of all, did a lot of great things. And quite frankly, some of the great things that they did, there's also unintended consequences. So it doesn't matter to me if you're a Democrat or Republican. What I'm just going to state to you is facts. Okay. When it first came out, I thought it was going to be wonderful. But once again, it had some unintended consequences. If you have an ACA compliant plan and you're a small business owner across the country, insurance companies can only make 15% profit. Did you know that?
Mm-mm. No.
Yep. So they can only make 15% profit. So when that first came out, that sounds really, really good, right? Hey, we can actually start controlling the cost of healthcare because they can only make 15% profit. Well, Sally, do you know how insurance companies make a lot of their money?
I know you do.
So it's called float. They make money really the same way that banks make money. So they're basically borrowing your premiums and they're reinvesting their premiums. And that's one of the ways that they're making a profit, right? So if they are only allowed to make 15% profit, and the cost of an MRI goes up $2,000 next year, is that good for their business or bad for their business?
Good.
It's good for their business because now they're making 15% off of a much larger number because they have to increase premiums to cover that cost, correct? So since the passage of the Affordable Health Care Act, there's been double-digit rate increases every single year in the small business sector for health insurance premiums. Now, Sally and Lee, I'm going to ask you another question. If I was a stockbroker and I could go to you and say, hey, you know what, for the next 20 years, I'm going to give you a 17% rate of return year after year, how much money would you want to invest with me?
I'd call you a fraud.
I would not sell my child, but I'd sell everything else.
That's exactly right. I hope you would say every last dime you have, because Albert Einstein said the eighth wonder of the world is the power of compounding interest. Okay. Now, you don't believe me? Go look at the stock prices of the large insurance companies. I won't mention any names prior to the passage of the Affordable Health Care Act. See what their stock prices are today. 200 to 8% increases. Now, I thought I was a pretty smart guy. Had I been smart back then, I would have invested in every single large insurance carrier out there. And we might not even be having this conversation today because I'd be on the beach sipping a margarita somewhere, right? So when I said earlier that there's misaligned incentives in the insurance industry, that's the misaligned incentive. So are they truly trying to control the cost of healthcare? It's bad for business. So hopefully that answers your question. And sorry, I get a little passionate from time to time, Sally, so you got me preaching on my pulpit there for a second. So I apologize if I was long-winded.
I appreciate that. So let's talk about what specifically you and Exemplar Health are doing to fix this issue.
This would be a 4-hour-long podcast if I really went down into the weeds, but I will definitely give you some really, really simple examples. So let's say that your shoulder was hurting and you went to your doctor, he sent you to a specialist and said, I think you have a torn rotator cuff. We need to get an MRI on that. Where's that doctor going to send you for the MRI more than likely?
To a facility that they own.
Yeah, to the hospital they're affiliated with, right? So an MRI typically at any major hospital is anywhere from $3,000 to $6,000, depending on one, where you're located geographically and MRI that you're getting done. Did you know that you can get an MRI done at a freestanding imaging facility for about $350?
I do now.
Yeah, there you go. Now, so what we do at Exemplar in order to incentivize you as a member or a customer of ours is, Lee, you know what? There's an imaging facility that's actually 10 miles closer to your house than the hospital. And if you go there, it's going to cost $350.
Hmm.
So, for you going there, we're going to waive 100% of your deductibles and copays. We're going to pay for it. You get to go get your MRI for free. Does that sound good to you?
Sounds great.
So that's one of the ways that Exemplar Health is fixing the issue. Now, why would we do that? Well, we do it because we're not paying a facility $5,000. We're only paying $350. To me, an MRI machine is an MRI machine is an MRI machine. It's who's reading the MRI to me that's important. Okay, because the results are going to be the same. So that's just one way. Another way, and once again, there's about 10,000 different ways that we're fixing the system. But the big topic of the day right now is prescription drug costs, okay, primarily specialty drugs. We have 10 full-time PharmDs on staff. We own multiple independent pharmacies as well under the Exemplar umbrella. And with few exceptions, the only thing that's special about specialty drugs is price. That's the only thing special about them. But because everybody wants the latest and greatest, and 75% of the TV commercials on TV are by Big Pharma, they want to take the latest, greatest specialty drug that's out there versus a particular prescription drug that's been curing the same disease for years and years and years and years and years and years. So there's a lot of different ways that we cost contain for prescription drugs inside the health plan. I consulted with a client yesterday, a fairly small group. They had $485,000 in prescription drug spend for the last year and only $150,000 in medical spend. They had a lot of people taking a lot of specialty drugs. Dirty little secret about Big Pharma. They come out with a new brand name drug. They get so many years where they can maximize their profits on that particular drug. That brand name drug then basically becomes a generic. What Big Pharma has done is they've gotten really, really, really smart. I see this a lot behind the scenes, is what they'll do is they'll take three generics, they'll compound it into one new pill. Now they got a new brand name drug. Well, if you really wanted to save money on a health plan and be a good consumer of healthcare and not drive it off the lot blindly, would you rather take three generic drugs, will waive 100% of copays, or one pill that costs $7,000 a month? Well, I'm sorry, you have to take three pills instead of one. Okay. So there's a lot of different ways that we can attack these. There's also what's called patient assistance programs that are out there. There's also copay cards and copay assistance programs. So there's a plethora of ways that we can attack almost every single situation. There's certain situations where we can actually erase people's hospital bills completely. Cancers are very, very expensive. This is unfortunate. It's not a matter if we get cancer, it's when and how bad. When I go give my speeches across the country, I say, name me somebody that you know that's lived to 90 years old that probably didn't have cancer at some point in their life. I mean, it's just going to happen. And the treatments for cancer are extremely expensive. We have a lot of different ways that we attack those cancer treatments as well. The treatments and the outcomes will not change, but the pricing does. And the list goes on and on and on and on and on. I mean, we could actually go down to labs. Labs don't seem like that's not very expensive. It's couple $100. But if we can do the same labs for $15, those little nickels and dimes add up to thousands of dollars. And what's nice at Exemplar Health is we're not publicly traded and we're not owned by private equity. So there's 23 companies under one umbrella. So at the end of the day, as CEO, I only have to answer to really two main people. It's our broker distribution partners that are believing in our cause and what we're doing, and the American consumer. I don't have to answer to a board of directors and shareholders or private equity. Once again, we're all about making a profit. We have to make a profit so we can bring these great solutions to the American consumer, but we don't have to be a profiteer. So how are we winning business all across the country? As long as we're profitable in one sector of our business, we'll win that group and win the life all day, every day. We have 254 W-2 employees in our office out of High Point, North Carolina, and our main goal is to get to 1,000 great paying jobs. It's not to buy a bunch of Bentleys. It's not to buy a bunch of vacation homes. It's not to get an $11 million bonus at the end of the year.
Yeah. I love what you're doing, and I love that you've got a crystal ball like you did looking back at the stock market, if you were to invest in Big pharma. So knowing what you know and where you've been and what y'all are doing, and there's, a lot of people that are really trying to break this system or fix a system that's broken. What does the future hold in regards to healthcare and the insurance industry?
If I do my job really, really well and we get great distribution, it's called a bulletproof car and a bulletproof vest because they're not going to like what I'm doing to the system. Okay. So the old adage, he who makes the money makes the rules, is absolutely not going to change anytime soon. But the great news is it's about educating and empowering the American consumer.
That's awesome.
And that's kind of our mantra. Here at Exemplar, we want to revolutionize the way healthcare is utilized and paid for. And it's all about education and empowerment. So what does the future hold? Is these plans exist? Our solutions exist. And then Exemplar is not the only one attacking the problem. Okay. There's a lot of other great companies that are doing it as well. And it's as we educate and empower the American consumer, you're going to start seeing the tide change. We are competing against very, 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 very smart companies and very, very, very smart people. So as we start affecting change, they're going to counterpunch. Wayne Gretzky's dad said the reason he was the best hockey player of all time is because he never fouled the puck. He skated in front of the puck. And one of the things that Exemplar is doing is, we're following legislation. We're following what our competition is doing. And part of my job at Exemplar is to skate in front of the puck. Where do I think the future is going? And that's really hard to do. It's very challenging, but we don't want to be reactive. We want to be proactive. So 10 years from now, I cannot tell you what that looks like. We have elections coming up. There's a lot of moving pieces. They're trying to attack pharmacy benefit management companies right now because there's a lot of fluff and money in the pharmacy benefit management side. So I can't tell you exactly what the future holds, but I can tell you exactly what today holds, and I can tell you what tomorrow holds. And then we're just constantly trying to skate in front of that puck. So, in a perfect world, what we have done is we've been able to stabilize pricing to the tune of we have our several customers that every year get premium decreases because they're great consumers of healthcare. That's unheard of in today's market. I can't predict the future any more than you can, but I can tell you that we work 24 hours a day, 7 days a week to make sure that we have the latest, greatest solutions that are out there.
And I would say staying a couple of steps ahead is as best as anyone can hope for in this market. So I love the analogy. I love Wayne Gretzky.
Yeah, Sally. I mean, you're exactly right. And, Exemplar, the dad joke that I tell everybody, it's the worst joke ever, is, Sally, did you see our Super Bowl commercial last year?
No.
You didn't?
No.
Well, that's because we didn't run one. So there's my dad joke of the day. Okay. So I can tell you that we're not planning on running a Super Bowl commercial anytime soon. So, this is organic growth with a great bunch of brokers and consultants nationwide that is educating the American consumer one person at a time. This is not a mass marketing campaign because we're using those dollars and resources to basically pass on to the American consumer. We don't need to do mass marketing campaigns. But with platforms like yours, hopefully this message gets out to more and more of the American consumer, the American employer, and it just helps us build and grow our brand a little bit more organically. The other thing, Sally, is we've been very, very blessed with significant growth. And sometimes I've made a mistake and we've grown too fast. That's a blessing and a curse. So two things that are moving our market right now are price and quality. And it's very rare that we lose on price, but quality is just as important to me than price. Mm-hmm. So we're a vertically integrated company. There's 23 companies under one umbrella. Member services is literally, I'm looking at my office right now and I'm looking into our member services department and seeing 34 people on a telephone working with our members right now. We're not outsourcing to different, how many times have you called a company to get passed around from one person to another person, then just get disconnected and you got to start the process all over again. So, from a growth standpoint, getting back to the growth standpoint, we want controlled growth and sustainable growth and create great jobs. If we grow too fast, our quality is going to go down, and I will not sacrifice our quality for growth.
Well, I love it. Well, and we are so excited to have Exemplar Health as part of the Granite List community. You guys are doing great work. So thanks, Tim, for being on today's show and for letting us help spread the word and share your story. And thanks to our listeners for tuning in to another episode of the Granite List Live.
Thank Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.